Hello, a very warm welcome to our guests and everyone watching here to this wonderful evening of panel discussion from Therapy. Exactly 5 months back, when we started our journey at Therapy, what we aimed at as our vision was to become and make our practice social justice informed and work towards empowering humans with values of equality, rights, and dignity, and accept and respect everyone by promoting inclusivity. Keeping in mind this stand, while the whole world is voicing out on breaking the bias and being equal, tonight in this panel discussion, we are going to explore that one basic question that hovers in all our mind is that are we equal? Let's together revisit gender equality. Here we feel extremely privileged and overjoyed to have with us as our panelists Dr. Manjula MY and Dr. Mythili Hazarika. Thank you so much, ma'am, for giving us your precious time and joining us.
Thank you.
To
Thank you.
begin with, yeah, Dr. Manjula, we feel extremely honored to have you. Thank you so much for coming here. So I'll just introduce briefly. Ma'am is a PhD in psychology. She has worked as a counseling psychologist initially, but later she moved to teaching and research. Currently, she is associate with Christ University, Bangalore, as a professor emeritus. She has attended several conferences, has many published papers to her credit, and guided PhD students. Ma'am is a humanistically oriented psychologist with a feminist leaning. She is concerned about myriad forms of inequality that exist in society but still dreams of an egalitarian society. Tonight, we are going to hear her views on the historical perspective of gender equality in a changing world.
Thank
Thank you. Yeah. Coming to Dr. Hazarika, ma'am, thank you so much for giving your time to us. Dr.
Thank
Hazarika
you.
has more than 20 years of experience in mental health care and services under the Health and Family Welfare Government of Assam. She is among the first to create a niche in mental health in Assam. She is the president of Society of Mental Health in lower and middle income countries and has been active in community mental health programs. She is a professional member of over 20 organizations and has to her credit more than 60 publications, edited books, and manuals. She was the first to develop the best practice guidelines for telepsychotherapy during the COVID 19 pandemic. She had personally addressed cases related to gender based violence and led the mental health task force called MONON in Assam, for which the World Health Organization has recognized her contribution. Moreover, MAM is associated actively with institutions working with and has support groups for LGBTQIA individuals. Today, MAM will enlighten us on the gender responsive approach towards well being. In this light, I want to mention that Therapy has recognized this year's Women's Day theme as gender equality today for a sustainable tomorrow. As every step towards it matters, with our initiative, Kadam, we aim to acknowledge and salute every small step that fathers, mothers, sons, and daughters have made towards gender equality. So please share your stories with us and join us in our journey together to break the bias. To begin with, I'll ask Dr. Manjula, ma'am, to please share your views on the historical perspective of gender equality in a changing world. And in this regard, I'd also like to know, we also like to know that how the society and people has changed over time in terms of gender equality. Over to you, ma'am.
Okay, good evening, everyone. I'm audible, right?
Yes.
Okay. So, to begin with, let me just start with a riddle, which goes like this. This was asked of us when we were doing our masters, my batch. Okay, and it goes like this. A doctor and a nurse get married and they have a child. Doctor is not the father of the child, and nurse is not the mother of the child. How are they related to the child? So we racked our brains and we came up with several answers, all of which were wrong. Okay. And now, when I pose this riddle to my students, some of them won't be able to come up with the right answer, but still, there are a few who are able to trace that The doctor is the mother of the child, and the nurse is the father of the child. That's how gendered we are. The moment we say the image that flashes to us is of a male doctor and a female nurse. That's how gendered the whole world is. Okay. Let me
True.
just start with, since I have 5 minutes, I'll just briefly summarize certain of the forms of discrimination that exist. We know that stratification has always existed and continues to exist, right? Different types of stratification, either based on gender, based on race, based on caste, creed, so many of these things. I would be mainly talking about gender based discrimination that has existed globally. So, initially, to bring in some of the forms that were there, which are not there, in China, there was a practice called as the foot binding, where they would put a metallic shoe to their girl's feet so that her feet do not grow beyond a certain length. For that, sometimes they had to even break the knuckles. And the foot, deformed one, as we address it now, would almost appear like a lotus. And it seems men would really get excited after this girl grew up into a woman. They would get excited on seeing that feet, the lotus feet of the girl. But because of that breaking of the bone and also the shortening of the feet, these women would always walk like this without having a proper balance. But that was considered very beautiful, and she had to undergo it for no fault of hers, just to please the larger society. That's one of the things. But now, I think for the past few decades, that practice is not there. The other practice, which is largely prevalent in the African countries, especially Cameroon and Chad, is a practice called as breast ironing, or it is also called as breast binding. And what the mother does it when the girl is a prepubescent and becomes a pubescent, she starts pounding her breast so that it doesn't grow. Why does she do it? Because to protect the girl. Mainly, they say that if a man comes to know that this girl is an adolescent, chances are that she'll get sexually abused. So, because of that. So, again, this gender discrimination is not because of her fault, but because of society's approach. And even now, this practice is there, and this practice is also there in some of the Africans who live in the United Kingdom. That means you can understand how the women had to go through certain of these discriminatory practices and bear with some of the pain just because it is a man-made society. And then to go ahead with another very heinous practice, that is the female genital mutilation. So recently I was listening to Egyptian feminist who just passed away a year ago, Nawal El Sadawi's lecture, where she mentions that in fact was examining a Sudanese woman once. She is a doctor by profession. She is also a writer. She was rather as also a writer and a social activist. She says because of her profession, she was examining a Sudanese woman, and she was in the gynecology. She was posted in the gynecology ward. She says she was shocked because not just the clitoris, the labia minora majora, everything was missing, mainly because she had undergone female genital mutilation. Even now, this practice is there where in some of the places only part of the clitoris is cut. And she mentions in her talk why it happens is mainly so that a woman is a pleasure giver, not a pleasure seeker, and so that she also stays monogamous in a marriage. So, for what fault of her? And she further goes on to say that there is also male genital mutilation, which is circumcision, which is rather done to increase the urge. It's as per Nawal El Sadawi, not as per any research that I have done personally. So she says, this is the way women get discriminated in society. So we also have had the chastity belts, the corsets, and all those things. And now we have come beyond all those things, but still, even now, currently, so historically, these were some of the things that were there, some of the discriminatory practices. So now, what are the practices that are there? When you read about Sandra Brem's gender schema theory, she said the stronger the schema, the more bias is there. And she also talks about the gender role imprinting that is there. A lot of times we behave in a particular way mainly because we have been imprinted and made to accept that's how you have to be. That's the right way to behave. So these are some of the things because of which we really go ahead with these things. And why I'm starting with all the negatives and the ones that really existed is so that at least I end with some positive note to understand what progress we have made. And I was recently reading about Amartya Sen's writing about missing girl child. So he mentions that in Asia alone, around 100 million girls are missing, mainly because of female feticide and female infanticide. And there's a cultural anthropologist who mentions that this hasn't existed only in the underdeveloped world. This exists in the developed world, and this has also existed in the nomadic tribe. And she says this mainly started because of the dowry system that was there, because the woman or the girl child was considered a burden, because of which this practice of female feticide and female infanticide actually started. So, to go ahead, when does this general discrimination start? Does it start after a girl becomes a pubescent, or does it start much earlier? It actually starts very, very early, right from birth. How does it start? The blues and the pinks, that's how it starts. We know in the Western world, if there is a baby boy born, you have to, your car has blue balloons, and then there is a blue dress for the child. You are not supposed to give a dress of any other color. And a girl gets pink. But when you try to understand why it is there, blue is indicative of health and longevity. So the wish is that the boy is healthier and the boy lives longer because of these blues and the pink started. So now it's time we come out of this mindset of blues and the pinks and come up with a rainbow of colors that our children can wear at birth. Because for no fault of its, the child is getting really groomed to become or behave like a boy or behave like a girl. Right? These are some of the things. But now, when we look at some of the progress that we have made some progress, especially when you look at the literacy, the gap that is there between the males and the females, it has reduced. And that's a very, very important growth, mainly because literacy is one thing, education is very empowering. The moment a girl child is educated, she will also learn the skills that are necessary for a good life, and then she can dream of an egalitarian society, and she can function in a society where she is accepted. When you look at some of the statistics, I think I look into my book and give you some of the statistics. Women are entering into the male bastion. The women, the first batch of women joined the services in 1992, and a few women have carved niche for themselves in the Indian Army. This is as per the 2-year-old data that I got. Around 0.56% of women are there, which comes up to 6,807 women. So you need to understand the gap that is there. So you are just 0.56, less than 1% of women, but still it is making inroads into a field which was totally male dominated. In the Indian Air Force, there is just a little over 1%. And in Indian Navy it is much higher, but the number is lesser because Indian Navy per se has less number of people. It's around 6.5%. When you look at women in the administrative posts, women who are CEOs, we all know that the number is abysmally low. And when you look at women politicians also, in the Lok Sabha, it is less than 15%, somewhere around 14%. And in the total parliament, taking the Lok Sabha as well as the Rajya Sabha, it's just 10.5%. And across the different states, the legislative assemblies, it is just 9%. So, and we have not been able to pass the women's reservation bill mainly because probably people presume an empowered woman as a threat to their existence. I'm not sure, it's just my conjecture. Probably that's the reason why we don't even table such things, or even if we table, we don't successfully pass them. So things are changing. But some of the very disturbing things that I saw recently, this was, I think, last fortnight. Uh, Pakistan government released brother of Kandel Baloch, who was killed by her brother in, I think, 2016. Why did they say? Why did they release him from the jail? Mainly, they felt that if a girl is doing something which is dishonoring the family members have a right to kill her. So we still have such practices. And just a fortnight ago, some of you might have seen it on the net. This was in Iran, where a 17-year-old young girl was decapitated by her husband, mainly because he did not tell, he presumed she had an extramarital relationship. After decapitating, he was moving around the town with her head. And that was too disturbing an image, and such things are still there. Apart from that, what happened in my state of Karnataka just yesterday was, this was an interfaith marriage, and the girl wanted to call it off mainly because she got to know that he was married earlier. When she sent a divorce notice to him, he hit her with a sickle 23 times, and she's battling for life. So, such gender discrimination still exists. It's okay, there is one rule for the male and another for the female. Though we have come, we have walked, we have made inroads, still a very long way to go. And I think all of us should work towards that, and gender equity will lead to gender equality.
Right,
So
right,
gender
ma'am.
equity is step one towards equality.
Absolutely, ma'am. Ma'am, thank you for beautifully giving us an account of how we and our society in different sectors have evolved in terms of gender equality. I'll just take 1 minute to acknowledge that Kolkata Anandam, which is an NGO and organization for equality and justice, is our collaborator for tonight. And with this, we move on to Dr. Mythili Hazarika. Ma'am, I would like to ask you to share your views on the topic of gender responsive approach towards well-being. And in this regard, how, how important do you think that a gender responsive mental health approach is required?
Right. At the very outset, I would like to thank Ananya for this invite and Ankita also for moderating beautifully this very enriching panel discussion.
Thank
And
you.
the topic is very pertinent. Are we equal at this point of time? As ma'am had rightly mentioned, a lot of discrimination still exists, has been there in the past and continue maybe to exist for the next 100 years, as the Economic Forum says, right? So, about are we equal? Well, this is itself is very thought provoking because we have to understand the context, the background, and the culture that the equality that we are talking about. So, basically, when we talk about gender equality, we are talking about unequal power relationship between women and men. That is one. And also about the unequal roles that our societies are attributing to men and women. And that is another thing that we have to keep in mind because gender responsiveness is about how we are aware of the different roles that women and men are having. I mean to say we are all different and we all have different strengths, and how to respond to these strengths is important at this point of time. So meaningful gender equality is not achieved, cannot be achieved unless we understand and respond to the different experiences and needs of women, because needs of women and men belonging to different groups is very different. So we also cannot assume that all women face the same inequalities and all men also have the same privileges, because it is across genders. So sometimes we see a lot of inequalities and a lot of discrimination happening in different dimensions in even in a men's life. So this kind of gender inequalities that we see at this point of time, we are not born with that. And as ma'am has rightly said, it is the social construct that we are talking about, the process of socialization, the parenting, so we have to start from the day one, like from the baby, when the baby is conceived or the mother conceives, because the inequality and the differences between the gender, we need to be more sensitive in the approaches. So during the COVID-19 also, what I saw is that sometimes these differences in women, that we are more caring, we are more nurturing, we are more compromising, had helped us in getting these counselors. So because when we were in need of counselors for our mental health program, so there were 7,800 people who came forward to do counseling in our helpline, from which I had taken 406 people, screened them. The majority of them were women. So that is our strength. We are in a profession that is a caring profession because of the inherent potential or the trait that we probably have, and that is also, nurtured by the society maybe, and reinforced by the society. So we also have diverse roles and expectations which cannot be based on gender stereotypes. That is where we come from. I mean to say, this panel discussion is also about the gender stereotyping. So responding to these diverse roles is being gender responsiveness, as we all know, and it is about the countries, the state, the household. I mean to say, across domains, that we have to ensure gender equality. Like for example, as this topic has been, I mean to say, touched a little bit by her, that how we groom our children. So basically, when as clinical psychologist, when we see the difference between what she said about color pink and color blue, that comes with parenting, because we groom our children with some specific roles. Like boys are assigned with certain specific roles and girls are assigned with certain specific roles, and we also expect that they kind of adhere to those roles. And we don't expect a girl to behave very aggressively or a boy to cry. So now I think the US president had come up with that boys can cry, and the gender neutral approach has been, um, I think they have started with that in the US at this point of time. So what happens is, in the children also, what we see, this multiplicity of roles that are not taught leads to a lot of gender equalities later on in life, because men will not do certain stuff, and they would not choose certain professions, thinking that this is women's profession. And then the inequalities, the inequities that rises, and that is a very, very crucial phenomenon, what I understand. And also, when I talk, when we think about the family planning, the gender responsiveness in family planning, I'm not talking the mental health domain, because mental health is always intrigued, and it is related to every aspect of one's life. Basically, in the reproductive health system, family planning system also, we are like very much associated with different kind of mental health issues. So what happens, what we see is that even the reproduction, women, they recognize that women has to take a lead in one's contraceptives, and whether she should be pregnant, or how many times she should be pregnant, what should be the age of her pregnancy, and can she have multiple children. But the men are not given those kind of constraints. So many a times, that also is a policy level, maybe we have to see from that dynamics also, that how reproduction and mental health also is one of the issues where gender responsiveness will should come in. So that is another issue. And also, about if we talk about the female patients, like segmenting the female patients and not considering them as homogeneous group. Like for example, if I have to talk about single mother, versus a married woman with multiple children. So we cannot see both the women in pregnancy in the same light. So we have to be responsive to the context that they have come up with. So gender responsive strategies may also include, supporting changes in the roles, sharing power at home, increasing men's engagement in women's health, and also to understand that women and men also face different kind of gender-based constraints, risk, and health outcomes. So, in the domain of mental health, what I see is that though gender is a very key social determinant of mental health, but gender is not routinely, we ourselves, we as mental health professionals, we do not consider gender as a part of the mainstream mental health policy or practice. And there is also limited evidence. If you go through the research, we have very limited evidence about gender responsive interventions. So women are more likely than men to be diagnosed with a range of problems. We know that women has depression higher than men, anxiety related issues higher than men, attempt suicide more than men, but the prevalence, the risk factor, the experience of poor mental health among women is also very different from men, because we have to understand from the social construct. But the mental health program and services that if you look into, there is none. So the mental health services also have failed women by ignoring the sources of their distress, because we have this multiplicity of roles, and we medicalize the problems, and we see not from the social structure, but we see from the biological structure more so, which again is not gender responsive approach. So in order to have a gender responsive approach which is effective and which would increase the recovery, there is no clear demonstration. So more research work has to be done with women specific intervention, what I understand, and also to prioritize understanding mental distress in the context of women's lives in a very different manner. Here, what we understand is we have to design certain policies taking women as the service users. The women need to come forward and enable, and they should be involved in initiative to promote mental health issues and make their own choices. We are not given that kind of choices, even if about in conception, from reproduction to choice of so many partners in life, as ma'am had rightly said, that the choices are limited for the women, and the trauma is more. And the trauma is actually, the trauma informed strategies are also not there. The trauma informed, when we see when we see the patients in our day to day practice, most of the problems what I see is based on gender based violence and gender based discrimination, which probably are the significant factors which is leading to different kind of mental health issues in women. But we definitely don't give those kind of conditions as important mechanisms for change. So in reproductive health, which I already said, that gender is a women's issue, which I think we need to give more importance to that, because as from birth itself, the birth control techniques and all needs to be collaboratively decided between both the partners. And women has to be seen from a life course perspective rather than a from a uh, one time perspective. It is a life course, as we call it, how women had evolved in generations and in their life cycle also. So to the mental health issues needs to be seen in that light, and the gender responsive approach has to be also in that light, about abuse, about family violence, about body image. A lot of backgrounds has to be taken into consideration. So I think this is a holistic community kind of an
Right.
approach that we have to think of taking in today's world. Otherwise, we'll not be gender responsive. And if we are not gender responsive, we will not be, thinking, we cannot think about gender equality in the long run. So that is the basic to
Right.
establish
Thank you, ma'am,
ourselves.
for
Yeah,
telling us how gender is so much ingrained in us in every aspect of our life. So,
yeah.
with this, I would like to introduce Ms. Sanjana Gupta. Thank you so much for joining us.
Thank
Ms. Sanjana Gupta,
you.
she is an active member of an NGO which is our collaborator, Kolkata Anandam, and she identifies herself as a trans woman.
Yeah.
So, Sanjana, I would really ask you to narrate how included you feel reaching this point of time, gender
Well,
wise.
Well, gender wise, I have a lot of problems. I have faced a lot of problem from the society, from my family, from everywhere. And today, what I am, it's all because of my ability. It's all because of my group people, my friends, my transgender people. They have given me courage. They have given me so much of hope that no, I have existent in this life. I have existent in this world as a normal male and a female. I also have an existence. So somehow I was not confirmed about myself. What am I doing? Where am I going? I have faced so many problems. There was certain period of time where I tried committing suicide as well. I was tortured, I was beaten up, I was child abused. So many things I've been through. Not only myself, if I talk about in general, everybody has gone through like that. My race, my transgender people, my community people have gone through a lot of trouble in the road, in society, in family, in friends, in parties, and everywhere. Everywhere, so many things have taken place. For an example, if I talk about myself, I ride scooty, right? So in the road when I was going, one person was driving and he tried pushing me. He tried pushing me and going away. I was about to meet with an accident, but still I somehow saved myself. And later on, I rode my scooty very badly, very recklessly. I rode and I tried stopping that person. There and there, I came to know he was an advocate. And after that, some police people came and they started charging me. There, I was not wrong. I was not wrong at all. I was driving very nicely. I was not riding recklessly, nothing. This was the simple and a normal example which I'm giving you, which I face, is just because I'm trans, so people are not bothered about me. And that policeman abused me so badly, insulted me so badly. They were telling me, "Come, take her to the police station, put her behind the bars." So many things happened, but somehow I managed to come out of it. But nobody stood behind. Nobody stood behind in that crowd because I was the only trans facing that problem. Then some when we go to any kind of malls or any kind of places or any place in general, there is no toilet for us. There is toilet for male and female. But what about trans? If we go to male, why are you coming here? You go to female. If we go to female, why are you coming here? You should go somewhere else. Where should we go? Where should we go? Where should we stand? What is our existence? People are abusing. People are giving us so many trouble, insulting here and there. But nobody is bothered about it. Nobody is bothered about it. So why? Why are we facing this problem? It's just because I'm trans. There is no education for us. If we go to school, if we go anywhere, for an example, if I talk about myself, when I was in school, "Oh, you are gay. Please stay away. Don't come here. Don't mix around with us. Oh, you are gay. Don't play this. Don't play that." Girls are telling different story. Boys are telling different story. Why? If I am feminist, if I am trans, it doesn't mean that I'm not in this world. It doesn't mean that I'm something out of this world. I'm not a garbage. People treat us like a garbage. In the road, so many comments. They passes through so many comments. And especially if I talk about police people are not at all. Not at all adjustable. They don't look at us only. I had a fight in the road, and police people are, I mean, they are like, oh, these people, they are rubbish. They don't know how to talk. They don't have culture. They don't have manners. Do we sound like that? Are we that? No. We also have heart. We are also human being. We also need love, wherein we don't get love. It starts from the beginning, from the house itself. What did I get? What did I get? Nothing. Only money. Money is the relationship with my family. Not only me, all my community people. They just want money from them. Just on. Whichever way you people want to earn, on. But take care of the house. And what about the male person in the house? What about the son in the house? They are not bothered. They don't have responsibility. If a person is going to work outside and if she comes back home, she wants to take rest. No, you cannot take rest because you are trans. It's not
Miss
that.
Gupta, like I really can understand through your voice how there is so much of difficulty in terms of responsibilities that you have to take, yet there's so much of lack of recognition. This is, I guess, really sad. And on this note, I would like to ask a final question to all of us here present. How much really do we have reached the goal of emerging into a sustainable gender equal society, and how much more is left to be traversed in this journey? How can we be more gender equal? Ma'am, Manjula ma'am, I would like to ask you, how do you think, are we really equal enough in this 2022?
Yeah. See, uh, most of the rules are made by men. So it naturally favors them. I'm not accusing all men, but I'm just telling you the reality that is there. Uh, the other day, when I was listening to again a feminist lecture, where she was mentioning that if there is so much politics even in religion, because most religious books and these are written by men, so most of the things are made by men, therefore it is favoring the man more than the woman. And also, we live in a world which acts as gender binary, right? And anything other than that, they find it very difficult to accept. But we need to know that that's also a reality which exists. Someone who is different from me need not be someone who is much below me, or someone who doesn't deserve respect. They also deserve respect, just like the male and the female deserve respect, they also deserve respect. So we need to sensitize our children, as ma'am was earlier mentioning. We need to really sensitize our children. So when does it have to start? It has to start right from the time they are in school. And at home also, what type of role models are we as parents? How do we behave? How do we speak about others? If my public persona, if it is very different from my private persona, the child copies my private persona, not the public persona. Publicly I may say many things, but at home, if I really condemn certain groups of people, look down on certain group of people, make derogatory remarks on some of them, it will not happen. So if we have to move towards a gender equal society, gender equity is the first thing that is necessary, and gender sensitization programs for children. And we adults, we need to walk the talk, not say one thing to the children and then we behave differently. When we do that, probably, as ma'am was mentioning, in 100 years, we may really be able to establish an egalitarian society. But for that,
Right,
every step matters. So therefore,
right.
education should and gender sensitization for should start right from school days. It should become part of the curriculum, where you have activities where they get to understand that we all are equal, and we all have our specific roles to play, but still, if all of us work in a united fashion, we can build a healthy society.
Right. Thank you, ma'am. Mythili, ma'am, I would like to ask you
Yeah.
that you have a vast experience in dealing with clients during the COVID time, during the pandemic time. What do you think is the impact of COVID on mental health across the gender spectrum? And in your clinical practice, how do you often see gender inequality coming up?
Okay. So we all know how COVID had impacted, it is across genders, but definitely disproportionately affected women. What I have seen, let me be very specific about my own experience, because when we had analyzed around more than 40,000 people during the COVID-19 first, 6 months in 2020, because we were calling up the COVID-19 people from our, Monon.
Hmm.
So we had gathered data from around 33 districts of Assam, and we found that females with COVID had more psychiatric and psychosocial issues. But again, what I found was we had also six helplines, all right? And the six helplines were for the people who could call us. And Monon was the task force where we used to call up the COVID-19 people, the people with COVID-19, I mean to say. But what we saw is that in the helplines, there were more male callers, having different kind of issues, like they were anxious and they were preoccupied with finance and when would the lockdown be, called off, and whether it's going to sustain for a long time, and a lot of those kind of questions about mostly related to their, you know, um, employment issues and job related issues. But women had called for depression and bereavement and also domestic violence, and they were stressed because of the multiplicity of roles. And one or two women, I still remember, we had to go and personally address her because she was suicidal, and she was about to go to the bridge. There is a bridge, Saraighat Bridge in Assam, to commit suicide. I mean to say, I had to intervene then and there. So this was a status, and depression, anxiety, as we all know, it's always common, but it definitely increased during that time. And also, I want to reiterate about the child and adolescent population. We had 406 mental health counselors, as I said, across India. They had joined us. And when they had called up the child and adolescents group, we found that the girls had more stress due to COVID-19, like around
Hmm.
57% of the girls. And it was more of family issues. But boys, as intergenerational hypothesis also suggests that it is more of a financial assistance about school, about when will they again start resuming their classes, and the career issues, and also those were certain gender differences we found in the kind of problems that they had come up with. And there was also the gender based violence that was again a shadow pandemic that we saw that was emerging.
Hmm.
And what we also saw is that the transgenders issues, because I am dealing, as she had rightly said, that there was no focus on the transgenders issues at that point of time. And I had a support group, I still run the support group for them. And there was no proper healthcare facilities for them, and
Not at all.
vaccinations and stuff like that, and that also had created a lot of mental health issues in them. Anxiety had definitely increased in
I'm,
them.
I'm, I'm
And
cutting off, ma'am. I'm
yeah,
trying
can
to
you
cut
hear
you
me?
off.
Yeah,
Yes,
can you
I
hear
can.
me?
I'm cutting you right here. I'm
Yeah,
extremely sorry. I apologize for that.
yeah,
I I have one more issue. Just now you said about the medicines and all.
yeah.
I went to take during this COVID-19. I
Mm-hmm,
went for injection for that vaccination.
mm-hmm.
I was not vaccinated just because I'm trans. No, no, you come later. Today it won't be
Yes,
possible. Bring a MLA letter or this letter, that letter, what all things they said. Aadhaar card, I had. I had my Aadhaar
right.
card. I was
Mm-hmm,
showing male and female. They were showing
mm-hmm,
Aadhaar card and they were getting vaccine.
mm-hmm.
I did not. Till date, I am not vaccinated. That is
Yeah,
also
that
a big
is,
issue.
yeah,
Why?
that is where I was coming to, because these were certain very, very specific, crucial issues that we had to face, and we had
Everywhere
to coordinate.
you.
Yeah, in
always been
Assam,
accused. Generally,
yes.
trans people are always accused just because of their sexuality. Why?
Hmm. Hmm.
If we are like this, we are not like, I mean, we have not made ourselves like this. We are born like this.
Right.
That's
We are
really
natural.
true. And yeah,
We are
yeah, we can
natural.
see
Yeah.
We
this.
are not fake.
And
this
Yes.
is this is where
as
I was,
Dr.
kind of where I was saying that, in psychologizing, sometimes we give labels to all these kind of emotional distress that she's talking about. We think it to be a mental disorder, which is not, because we have to see from the socio-political and where she is coming from,
Some people
because
say, some
yeah.
people say we are mentally disturbed.
Hmm.
They are not women. They are not trans. They are males. Just
That's an
because
Right.
easy
they
way
are
to
mentally
tag.
just because they are
Right.
mentally disturbed, they change their sex, they become trans, they become dress up like a girl.
Hmm.
No, we are not mentally disturbed. We
Yeah,
are
so that is
Right.
that
we
is what
can
we
do
have to
everything.
understand, I think,
Human
Sujata. What we have to
everything.
understand, yes, what we have to understand is that is where I was coming, to the social construct that is very important to take into account before medicalizing issues and before labeling. So in our helplines also, we not only about trans men, I mean to say females, females with issues of unpaid care work, with school closures and heightened care needs of the ailing family members at home. And they also expressed their frustration and anger, and some people were also saying that after the lockdown is over, we are waiting for the family, court to open, because we are going directly to get divorce. So because the domestic violence for forced togetherness was very, very high, and also the financial stresses, because women, because of the temporary kind of work that they used to do outside their family, also they lost them. So many reported that there were some old conflicts that had emerged, which was under the carpet, and so a lot of re-emerging issues had taken place, and that we call it as a return of the repressed. And
Right.
but what I see in the initial phone calls that we had found in our helpline was about misinformation, a lot of misinformation, confusion about the government policies, and that had led to a lot of anxiety, in this population. And most of
A
the
lot.
times it is the gender stereotypy, which was
Right.
contributing to
And
psychiatric
I guess
issues.
this gender
Yeah.
stereotype is something that truly affects people who are not really
Yes.
in that binary, like people like Sanjana, like us. Even cisgenders face a lot of challenges as well.
Right.
Cisgender, transgender, be it any gender. And in that,
Hmm.
I would like to ask Dr. Hazarika, as Manjula ma'am has said, that we have to change certain things since birth in our mindset. So, what, in your
Hmm.
opinion, can how can we be more gender equal?
We first have to learn what we have to unlearn what we have learned, because it's so ingrained, as ma'am had rightly said, because it's across developed and developing countries. I'm not talking only about India and our country, but it's across people, it's human, mankind. So it will take a long time, I guess, because today my colleague was saying that he had gone to buy a phone with a blue colored cover, and his two daughters were saying that, why blue color, you are being, again, discrimination about blue and pink color, so you should buy a pink color, daddy. So if these kind of strategies are inculcated from the educational system, I think, these are the certain changes that we can see. And also from day one, about knowing about the fetus, about the sex of the fetus, that how we can stop that. And reproduction, as I have all the time saying, reproductive health is not a women's issue. Many a times the disability in a child is not because of the women, it is because of the men, right? Scientifically. So whether men also can produce a lot of children or can bear a lot of children is again a medical issue that we need to make some policy level changes, maybe. Because many a times what I see in the disabled children, the other day a child with disability had come to me. He's 27 years with autism spectrum disorder. It was so sad to see that the father was told by some neurologist that in autism there is no cure. He's just going to look at the sky and rest of the life is going to stay like that. Mother had belief on her child that he is capable of doing something. And she is actually she's a BTech engineer, but she gave up her profession because the father was saying, you have to take care of the child, because taking care of the child and a disabled child is your domain, that is your responsibility, that is not my responsibility. And he cannot go to school because the neurologist has said that he is going to look at the sky, and rest of the time, rest of his life is going to stay like this. So mother did a lot of stuff with the child, and it appeared to be a high functioning autism with great mathematic skills, and savant syndrome he has. And I have diagnosed that he can do a lot of stuff. But the father says it is because of you that the child had become autism, so you have to take care of it. So this is where we are coming from. Everywhere women is responsible for anything bad that is happening, anything negative that is happening in our next generation. But the father or the male doesn't, or the man doesn't take the responsibility. Right. So this is where the reproductive health system is, again, is very much intertwined with mental health issues, which education is required for a dramatic
Right.
change here. you know and there has to be some curriculum maybe in the school. And now school also is distance learning, where women, girls are, it is a lot of gap about girls education now, because what I have seen in my rural population in Assam, girls are not given the phone. I mean to say, if
No.
there's an Android phone, it cannot be
Yes.
shared, because the boys are given the preference to use the phone from their parents side. And they say that the boys, they have to definitely learn and then get educated and do something. Girls will get married, so it's better that they don't, we don't have to share the phone. So this is where, India, maybe this is where India is lacking behind and lagging behind. So how we can make this equal? Education for both the sexes, both the genders are important. And that has to start from the policy level changes maybe. And that's a big thing, the school. Because I'm very, very worried. I mean to say, all the mental health professionals, I think we are all very worried. The learning that is taking place in such a
Yes.
manner is definitely create a lot of gap, which already
Very much
existed between both the
important is
genders.
education at this point of time.
Right,
Very
right,
much important. And that
right.
is where my community people are lacking behind.
True.
That
Yeah.
is where
Yes.
my community people are lacking behind. And that is also people are lacking behind because of other people. When people are
Hmm.
accusing us, even the teachers are accusing us just because. Okay, I'm talking about again one more example about myself, my personal experience. When I was in school, my teacher used to come, biology teacher or maths teacher or anyone. Oh, you go out. I did not do anything. Nothing. I was quiet. I was not even talking. Either you go out or you sit back. Why? Just because I'm feminist. This is what I have also gone through. I don't know, but still,
Yeah.
I am 110% sure my community people are going through this problem. Are going through
Right.
this problem. They should be.
Yeah,
There should
Sanjana,
be
Sanjana,
equality.
I want to add certain good stories also from Assam, some positive stories of trans women and men that I'm dealing with. Because we
Oh,
have had couples, I have had couples who had gone through sex reassignment surgeries and all. And we were in the talk shows and all. And after that, what happened? There are certain communities in Assam, very, very interior rural villages. They have come forward to accept that couple, and they have done all their the help that they had provided is immense. They had provided money, they have provided shelter to this couple
Wow.
to establish themselves, and also to rear up a child, adoption issue. And I was the mother who had witnessed their marriage also.
It
So
should
there
be.
are certain
Here
good
in
stories
Kolkata as
also. Yeah, there are in Assam. I think in northeastern region, not in Assam, in northeast. I think we come from a very, very different land. So the matrilineal, the matriarchal society still exists in Meghalaya, right? So women in some ways are
in some ways.
empowered, and yeah, in
And
certain ways. And also these transgender issues, it's not that negative here. It's just kind of a transition is being seen, in my practice, what I have seen in the last 10 years, because a lot of people are coming forward, and we have this gay parade and stuff like that, and people are also in the medical college. The other day, what happened, there was a medical student who wanted to commit suicide, and he said that it's from here, from from our I'm not going to name the medical college in Assam. So he came forward and he was like very highly suicidal, because he was not, as you said, not accepted by the medical fraternity in that particular college, because of cross dressing and being feminine, and he didn't have a toilet, he didn't have a hostel, because he wanted a separate hostel, he did not want to be in the boys hostel. So when he came forward and all, then he said he was highly suicidal. I did intervention with him, therapy, and then calmed him down, gave empowered him, do certain things. And I also spoke to the principal of that medical college. The principal had arranged a separate room for that person, and there was a kind of a seminar talk that was arranged. I was there, I spoke about it, and after that he's accepted, and he is now completely a girl, and he roams around, and everyone, he's made friends out there. So
Wow.
the change is happening. Maybe, yeah, it is slow though, but
Right.
we definitely have to keep doing our bit, I guess.
Yeah. So
The education.
on one hand,
Yeah.
as we hear from Sanjana, that there is still a lot of inequality and lack of recognition and opportunities. I am really happy to know about these positive stories in Assam that
Ah,
is coming up in our country. Yeah,
nice.
and like with this, we come to the fag end of our discussion. Here, I would like to introduce our chief founder and clinical psychologist, Dr. Ananya Sinha, who also wants to share her views. Miss Ananya, over to you.
Hi.
Um,
Hi.
hi, hello everyone. It gives me a lot of pleasure to really be a part of this panel. I
I'm
really want
also
to thank.
honored that I can see you people, I can talk to you people, I can speak my heart to you people. I'm really
Thank
honored.
you. Thank you. Thank you. I'm really grateful to Dr. Manjula and Dr. Mythili to take out time from their busy schedule to be a part of the panel, and Sanjana for sharing. It was really heart wrenching to listen to your stories. So thank you for sharing, and that probably gives us the picture of where we are at in terms of gender equality. I thought I'll just read out from one of the comments we had from the participants, where Surpi is saying that gender inequalities are so pervasive and deep rooted personally and externally, and currently one cannot contemplate what an equal society may look like. It requires a complete and united restructuring. I thought that was such a wonderful way of summarizing everything and what this discussion is all about. So, on this note, I thought I'll also introduce the audience to Therapy, the organization that that is organizing this particular panel discussion. So I just put it in the slide. So Therapy is a global online mental health platform with a team of licensed, multilingual, multiculturally competent clinical psychologists trained from the best institutes like NIMHANS, IBHAS, providing online ethical, queer affirmative, and culturally sensitive psychological services. What we stand for, these are the primary values that we stand for: compassionate care, professional integrity, ethical practice, uh, i- inclusivity, and social justice informed. So I just wanted to highlight this entire talk was organized because we do want to uphold inclusivity and we do want to be social justice informed. And this is our website. If you want to refer someone, um, we have the website ID is therapy.in. So anybody can go and log in. And we also wanted to show you our initiative Kadam, with Ankita had talked about at the beginning. So Kadam is an initiative by Therapy, which is a small step towards equality. So what we are saying is gender is binary, gender is unequal. And this is what most of us learn and experience throughout our lives. Sometimes we feel marginalized, discriminated against. Sometimes we see ourselves in a privileged, advantageous position. Inequalities might be discomforting, conflicting with our values, and might feel unacceptable. That is when we take small steps towards equality. Kadam is a humble initiative to acknowledge the small steps each one of us takes as a son, as a daughter, as a husband, as a wife, as a mother, father, as ourselves towards gender equality. Because every step makes a difference. We had started the initiative and we have heard a voice of a father, a mother, husband, and a wife, and we have lots and lots more to cover. So, on that note, I want to acknowledge this discussion as our small kadam towards equality, because each one of us, even this discussion, I was reading some wonderful comments in the comment section. So, each one of us can really make a difference. And thank you, everyone, for coming together for this particular discussion. Thank you.
Thank you so
Thank you,
much
Ananya.
for
Thank
Thank
you.
you,
Dr.
Ankita.
Manjula, Dr. Hazarika, and Sanjana for giving us a view of the current society and also how we can create a mindset towards betterment. And with this, I end with a hope for a better tomorrow where all of us, be whatever gender we identify with, that we can live with well being, respect, and dignity. Thank you so much for your
Thanks.
joining with us. And thank you so much, all the audience, for being with us here.
So, very good
Good night.
initiative.
Take care.
Wish many more things come from your organization. Best wishes to
Thank
both
you
of
so
you.
much.
And
Thank you so
thanks
much.
to all the co panelists. Thank you all so much.
Yeah, best wishes from me too. And congratulations. You people are really doing a good job.
Yeah.
Thanks.
Thank you. That
Okay.
Thank
really
you so
means
much.
a lot. And it was really good to hear your perspectives. And I'm sure the audience is enriched today with your experience perspectives on gender equality. Thank you.
Hopefully. Thanks. Bye. Bye. Bye.
Thank you.
Bye bye. I am very
Thank you. Good night.